Hey, healthy family, and welcome back to We Healthy. We talk a lot about diet and fitness, but what is the most important muscle in your body? That's right, it's your heart. It beats over 100,000 times a day, keeping you alive. And yet, heart disease remains the leading cause of death globally. That's why today we're going deep. We've compiled 50 of the most critical, common, and complex questions about heart health, and we're giving you detailed, doctor-approved answers. We're covering everything from the difference between a heart attack and cardiac arrest to the role of statins and the significance of your cholesterol numbers. Grab a notebook. If you care about living a long, healthy life, stick around. Let's jump straight into the 50 vital questions.
1. What is the primary function of the heart?
Answer. The primary function of the heart is to pump blood throughout the body via the circulatory system. This blood delivers oxygen and nutrients to all tissues and organs, while simultaneously carrying away carbon dioxide and metabolic waste products. It acts as a double pump. The right side sends deoxygenated blood to the lungs, and the left side sends oxygenated blood to the rest of the body.
2. What are the four main chambers of the heart?
Answer. The four main chambers are the two upper atria, right and left, and the two lower, more muscular ventricles, right and left. The atria receive blood, and the ventricles pump blood out of the heart. The left ventricle is the strongest, as it must pump blood to the entire body.
3. What is a normal resting heart rate for an adult?
Answer. A normal resting heart rate, or RHR, for healthy adults typically ranges from 60 to 100 beats per minute, BPM. Highly conditioned athletes, however, may have an RHR as low as 40 to 60 BPM due to greater cardiovascular efficiency. A consistently high RHR can sometimes be a sign of poor fitness or an underlying health issue.
4. What is the difference between a heart attack and cardiac arrest?
Answer. A heart attack, myocardial infarction, is a circulation problem, occurring when blood flow to a part of the heart muscle is blocked, usually by a clot, causing a portion of the muscle to die. Cardiac arrest is an electrical problem, occurring when the heart's electrical system malfunctions, causing the heart to stop beating effectively, leading to loss of consciousness. Cardiac arrest can sometimes be triggered by a heart attack.
5. What is atherosclerosis?
Answer. Atherosclerosis is a disease where plaque, a buildup of fat, cholesterol, calcium, and other substances, accumulates inside the arteries. This buildup causes the artery walls to thicken and harden, narrowing the artery and reducing or blocking blood flow. It is the underlying cause of most heart attacks and strokes.
6. What is an arrhythmia?
Answer. An arrhythmia is an abnormality in the heart's rhythm. This means the heart can be too fast, tachycardia, too slow, bradycardia, or irregularly. It occurs when the electrical impulses that coordinate the heartbeats don't work properly. The most common type is atrial fibrillation, or AFib.
7. What is the significance of the coronary arteries?
Answer. The coronary arteries are the blood vessels that supply oxygenated blood specifically to the heart muscle itself. They branch off the aorta. When these arteries become blocked by plaque, coronary artery disease, the heart muscle starves for oxygen, leading to angina, chest pain, or a heart attack.
8. Why is high blood pressure, hypertension, a risk factor for heart disease?
Answer. Hypertension forces the heart to work much harder to pump blood against the increased pressure in the arteries. Over time, this extra strain causes the heart muscle to thicken or hypertrophy and weaken, and it damages the artery walls, making them more susceptible to atherosclerosis. It increases the risk of heart attack, stroke, and heart failure.
9. How does high cholesterol contribute to heart problems?
Answer. High levels of LDL, bad cholesterol, are a primary component of the plaque that builds up inside arteries, atherosclerosis. As plaque hardens and narrows the arteries, it severely restricts blood flow and can rupture, forming a clot that blocks the vessel entirely, causing a heart attack or stroke. HDL, good cholesterol, helps remove LVL from the arteries.
10. What is the biggest modifiable risk factor for heart disease?
Physical inactivity significantly increases the risk of heart disease. Exercise helps strengthen the heart muscle, improve circulation, lower blood pressure, reduce LDL cholesterol, raise HDL cholesterol, and help manage weight and diabetes. Lack of exercise contributes to all these negative risk factors.
11. How does physical inactivity impact heart health?
Answer. Physical inactivity significantly increases the risk of heart disease. Exercise helps strengthen the heart muscle, improve circulation, lower blood pressure, reduce LDL cholesterol, raise HDL cholesterol, and help manage weight and diabetes. Lack of exercise contributes to all these negative risk factors.
12. How is obesity related to poor heart health?
Answer. Obesity, especially excess weight around the waist, is strongly linked to heart disease. It often leads to other major risk factors, including type 2 diabetes, high blood pressure, and high cholesterol. The excess weight forces the heart to pump more blood to nourish the extra tissue, placing continuous strain on the cardiovascular system.
13. Why is managing type 2 diabetes crucial for heart health?
Answer. Uncontrolled diabetes leads to chronically high blood sugar, which severely damages the blood vessels and nerves that control the heart. People with diabetes are 2 to 4 times more likely to die from heart disease than those without it. This damage accelerates atherosclerosis and increases the risk of heart attack, stroke, and kidney disease.
14. How does chronic stress affect the cardiovascular system?
Answer. Chronic stress triggers the release of hormones like cortisol and adrenaline. These hormones can cause the heart rate and blood pressure to rise, and they may also contribute to artery damage and inflammation. Over time, persistently high stress can directly contribute to hypertension and other heart issues.
15. What role does diet play in heart disease prevention?
Answer. A heart-healthy diet is fundamental. It emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats, like olive oil. This type of diet helps control weight, manage blood pressure, reduce inflammation, and lower harmful LDL cholesterol. A diet high in saturated fats, sodium, and refined sugars has the opposite effect.
16. What is an ECG?
Answer. An ECG, or EKG, is a quick, non-invasive test that records the electrical activity of the heart. It shows how fast the heart is beating and whether its rhythm is steady or irregular. It can help detect arrhythmias, heart damage from a past heart attack, and signs of coronary artery disease.
17. What is an echocardiogram?
Answer. An echocardiogram, often called an echo, is a type of ultrasound test that uses sound waves to create a moving picture of the heart. It provides detailed information on the heart's structure, chamber size, pumping function, and the function of the heart valves. It's often used to diagnose heart failure or valve problems.
18. What is a cardiac catheterization?
Answer. Cardiac catheterization involves inserting a thin, flexible tube, which is a catheter, into an artery, usually in the leg or wrist, and guiding it to the heart. It is used to measure pressure and oxygen levels in the chambers, But its primary use is to perform an angiogram, which is injecting dye to visualize blocked coronary arteries, and often a PCI, stent placement.
19. What is a cardiac stress test?
Answer. A stress test monitors the heart's function while it is under physical strain, usually by walking on a treadmill or cycling. It checks to see if the heart muscle is getting enough blood flow during exercise. If a patient cannot exercise, a medication is used to chemically stress the heart. It is a key diagnostic tool for coronary artery disease.
20. What do blood tests for troponin indicate?
Answer. Troponin is a protein released into the bloodstream when the heart muscle is damaged. A troponin blood test is the definitive test used in an emergency setting to confirm whether a person has experienced a heart attack. The higher the level of troponin, the greater the heart muscle damage.
21. What is a coronary computed tomography angiography, CCTA?
Answer. CCTA is a non-invasive imaging technique that uses a powerful X-ray machine to create detailed 3D images of the heart and coronary arteries. It can show the presence and extent of plaque buildup, calcium and blockages in the artery walls, helping to identify coronary artery disease without invasive procedures.
22. What is congestive heart failure?
Answer. Heart failure is a chronic, progressive condition where the heart muscle can no longer pump enough blood to meet the body's needs. The term congestive refers to the resulting fluid backup, where blood pools in the lungs, feet, and abdomen. It often results from years of high blood pressure or damage from a heart attack.
23. What is a stroke, and how is it related to the heart?
Answer. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. The most common type, an ischemic stroke, is often caused by a blood clot that traveled from the heart, especially in cases of atrial fibrillation. The heart is a common source of these clots.
24. What is atrial fibrillation, AFib?
Answer. Atrial fibrillation is the most common serious type of arrhythmia, where the two upper chambers, atria, beat chaotically and irregularly, often very quickly. This causes blood to pool and clot in the atria. AFib is a major cause of stroke, which is why blood thinners are often prescribed to prevent clot formation.
25. What is endocarditis?
Answer. Endocarditis is an infection of the inner lining of the heart's chambers and valves, the endocardium. It is typically caused by bacteria or other germs entering the bloodstream and traveling to the heart. It can seriously damage the heart valves, leading to heart failure, and often requires strong antibiotic treatment.
26. What are common symptoms of a heart attack in women?
Answer. While men often experience classic crushing chest pain, women are more likely to experience atypical or subtler symptoms, including unusual fatigue, weeks before or during the event, shortness of breath, pain in the neck, jaw, or back, and feelings of nausea or lightheadedness. These symptoms can be easily overlooked.
27. What is cardiomyopathy?
Answer. Cardiomyopathy is a disease of the heart muscle that makes it harder for the heart to pump blood to the rest of the body. There are various types, including dilated or hypertrophic, but all involve the heart muscle becoming enlarged, thick, or rigid. It can lead to heart failure and arrhythmias.
28. What is a heart murmur?
Answer. A heart murmur is an extra or unusual sound heard during the heartbeat, caused by turbulent or restricted blood flow through the heart. While many are innocent, benign, a new or loud murmur can indicate a problem with the heart valve, like a leak or narrowing, or a structural defect.
29. How does an angioplasty and stent procedure work?
Answer: Angioplasty is a procedure where a balloon-tipped catheter is threaded to a narrowed coronary artery, and the balloon is inflated to compress the plaque against the artery wall. A stent, a small mesh tube, is then usually left in place permanently to keep the artery propped open, ensuring sustained blood flow.
30. What is a coronary artery bypass graft, CABG surgery?
Answer: CABG, often called bypass surgery, is a major operation performed to treat severe blockages. A surgeon takes a healthy blood vessel, a graft, from the chest, leg, or arm, and uses it to create a new path, bypass, around the blocked section of the coronary artery. This restores blood flow to the heart muscle.
31. What is the purpose of blood thinner, anticoagulant medications?
Answer: Blood thinners are used to prevent the formation of harmful blood clots that can block blood vessels, leading to the heart attack, or brain, stroke. They are commonly prescribed for conditions like atrial fibrillation or after a heart valve replacement to reduce the risk of clot formation.
32. How do statins help manage heart health?
Answer: Statins are the most common type of cholesterol-lowering drugs. They work by blocking an enzyme in the liver that is necessary to produce cholesterol, thereby significantly reducing the amount of LDL, bad cholesterol, in the blood. They also have an anti-inflammatory effect on the artery walls.
33. What is the function of a pacemaker?
Answer: A pacemaker is a small, battery-powered device implanted under the skin near the collarbone. It uses electrical impulses to help the heart maintain a normal, regular rhythm. It is primarily used to treat bradycardia, a heart that beats too slowly, or other types of arrhythmias that cause fainting or fatigue.
34. What is an ICD, implantable cardioverter defibrillator?
Answer: An ICD is a more advanced device than a pacemaker. It is designed to continuously monitor the heart's rhythm and is used for patients at high risk of sudden cardiac arrest. If it detects a life-threatening, chaotic rhythm, like ventricular fibrillation, the ICD delivers a strong electrical shock, defibrillation, to reset the heart.
35. What is cardiac rehabilitation, cardiac rehab?
Answer: Cardiac rehab is a medically supervised program for people recovering from a heart attack, heart surgery, or other cardiovascular events. It includes 3 core components: supervised exercise training, education for heart-healthy living, and counseling to reduce stress and manage risk factors. It is essential for long-term recovery and prevention.
36. What is the recommended frequency and duration for aerobic exercise for heart health?
Answer: The American Heart Association recommends at least 150 minutes per week of moderate intensity aerobic exercise, like brisk walking or cycling, or 75 minutes per week of vigorous intensity activity, like jogging or running. This should ideally be spread across most days of the week for maximum benefit.
37. What is the DASH diet, and why is it recommended?
Answer: The DASH, Dietary Approaches to Stop Hypertension, diet is an eating plan designed to lower blood pressure. It emphasizes foods rich in potassium, calcium, and magnesium, like fruits, vegetables, and low-fat dairy, while strictly limiting sodium, saturated fat, and sugar.
38. How much sodium is generally recommended to limit for heart health?
Answer: For most adults, a goal is to consume no more than 2,300 milligrams per day of sodium. However, people with hypertension or heart failure may need to aim for a stricter limit, such as 1,500 milligrams per day. Excess sodium intake leads to fluid retention and higher blood pressure.
39. How does sleep deprivation affect cardiovascular health?
Answer: chronic lack of sleep, less than 7 to 8 hours per night, can negatively impact heart health by increasing the risk of high blood pressure, diabetes, and obesity. It can also elevate stress hormones and inflammation, both of which are risk factors for atherosclerosis and heart attacks.
40. What is metabolic syndrome and its connection to heart disease?
Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. The 5 defining factors are high blood pressure, high blood sugar, excess abdominal fat, high triglycerides, and low HDL cholesterol. Having 3 or more of these indicates the syndrome.
41. Is moderate alcohol consumption beneficial for the heart?
Answer: for some people, light to moderate alcohol consumption, for example, 1 drink per day for women, 1 to 2 for men, may be associated with a slightly lower risk of heart disease. However, this is controversial, and excessive drinking is strongly detrimental, leading to high blood pressure, stroke, and cardiomyopathy. Experts do not recommend starting to drink for heart benefits.
42. What is the immediate first aid response for someone having a suspected heart attack?
Answer: the immediate response is to call emergency services 911, 112, or 999 immediately. While waiting, have the person rest, loosen tight clothing, and if they are not allergic and are instructed by the dispatcher, they should slowly chew an aspirin, 325 milligrams, which helps thin the blood and can reduce heart damage.
43. Can you inherit a risk for heart disease?
Answer: yes, genetics plays a significant role. A person is at higher risk if a first-degree relative, parent or sibling, had heart disease before age 55 for men or age 65 for women. However, inherited factors often combined with lifestyle choices. Genetics loads the gun, but lifestyle pulls the trigger.
44. What is peripheral artery disease, PAD?
Answer: PAD is a common circulatory problem where narrowed arteries reduce blood flow to the limbs, most commonly the legs. It's caused by atherosclerosis. Symptoms include leg pain when walking, claudication. PAD is a strong indicator of widespread atherosclerosis and significantly increases the risk of heart attack and stroke.
45. How is cholesterol screening performed and what numbers are important?
Answer: cholesterol screening involves a fasting lipid panel blood test. Key numbers are total cholesterol, LDL, bad cholesterol, ideally below 100 milligrams per deciliter, HDL, good cholesterol, ideally above 60 milligrams per deciliter, and triglycerides, ideally below 150 milligrams per deciliter.
46. What is an implantable loop recorder, ILR?
Answer: an ILR is a small device inserted just beneath the skin of the chest for up to 3 years. It is used for long-term, continuous monitoring of the heart's electrical activity. It is often used to diagnose very infrequent or elusive arrhythmias that are missed by shorter-term monitors.
47. What is cardiac hypertrophy?
Answer: cardiac hypertrophy is the abnormal thickening and enlargement of the heart muscle, particularly the left ventricle wall. It occurs as a response to chronic overload, most commonly severe, long-standing high blood pressure. While initially a compensatory mechanism, it eventually makes the heart less efficient and can lead to heart failure.
48. What does the term ejection fraction mean?
Answer: ejection fraction, also known as EF, is a key clinical measurement that represents the percentage of blood pumped out of the left ventricle with each heartbeat. A normal EF is typically 50% to 75%. An EF below 40% can indicate heart failure or damage from a heart attack, meaning the heart is pumping inefficiently.
49. How does chronic kidney disease, CKD, relate to heart health?
Answer: CKD is a major risk factor for heart disease. The two conditions often coexist in a vicious cycle. Damaged kidneys cause a buildup of waste products and fluid, which increases blood pressure and strains the heart. Conversely, heart failure can reduce blood flow to the kidneys, worsening CKD.
50. How does vitamin K2 potentially support heart health?
Answer: vitamin K2 is thought to play a role in calcium regulation. Research suggests it may help direct calcium away from the arteries, preventing calcification and hardening of blood vessels, and into the bones. While promising, more research is needed to confirm a direct causal link for general heart health recommendations. Wow, 50 questions, 50 detailed answers. We just covered a massive amount of ground to secure your long-term heart health. Remember, knowledge is power, and when it comes to your heart, prevention is everything. If you learned something new today, maybe about your ejection fraction or the silent symptoms of a heart attack, please hit that like button and subscribe to We Healthy so you don't miss our next deep dive. Let me know in the comments below, which heart health fact surprised you the most? Stay informed, stay healthy, and we'll see you in the next video.